Well, this is part one of my four-part talk, and this concerns cancer funding, not only in the UK or US, but all around the world. And I honestly thought that this would be probably the easiest section of my talk to give, because the statistics would be easily available, and I wouldn't need to dig into the internet very much to get the figures. But actually, what confronted me was a bramble bush forest of links and connections to different parts of Cancer UK's, Cancer Research UK's website, to the NCI website of the National Institutes for Health in the States. And so I found it much more difficult than I thought. But so let me start by at least giving you the basic figures that I found. And the first thing I found was that Cancer Research UK, CRUK, invested £399 million in cancer research in 2023-24. And that was actually out of a total fund of 600 or more million pounds. So about 2/3 of their available money was going actually into cancer research. But that's not the end of the story, because where that money is coming from, over 60% of that money comes from the private individual, from the taxpayer, and from other donors who have given CRUK their money. But that is quite a lot. The government, the UK government, apparently invested £121 million in 2022-23. Sorry, yes, 2022-23. And actually that points to a little thing I also noticed, that some of these figures are way out of date. I mean, whereas, one would expect to see the 2023 figures by now, nearly the beginning of, well, it is the beginning of 2025, much of their statistics relates only to periods like 2018, 2016, and that kind of area, at least 5 years before. Now, that's not so much the case with the United States, where the figures, in my opinion, are much easier to get hold of and much more up to date. And another big challenge that faced me when I was trying to get these figures together was the number of institutions involved, and they all got their own acronyms. I ended up writing out a list of some of the acronyms which the cancer industry uses to identify itself. We've got the LRCF, which funded about £64 million a year. The CRC, Cancer Research Council, which funded about £61 million a year. But there are all these other government and non-government institutions, charitable institutions, like AICR, a company called Breakthrough, Leukemia Research, the Ludwig Institute, the Marie Curie Institute, Tenovus, the Yorkshire Cancer Institute. I mean, there are so many of these, but by and large, the total amount of investment in cancer research let's say in 2023, because it's the nearest I can get, and although some of those figures are earlier than that, is seriously around about, well, over £400 million. But in the United States, if you took it as a rate of pounds per 100,000 or 200,000 population, the United States pays or funds at least 5 times as much per individual person in the population. So the UK is not by any means the hardiest of investors. Mind you, the NCI, in the National Cancer Institute in the United States, which is part of the National Institutes for Health, there are 9 others, or 9 altogether, I think. They don't exactly have a clean bill of health. They've had some how shall I say, difficult moments in the past. For example, they stole the HIV virus from the Pasteur Institute, who took them to court, and the NCI accidentally sent them a couple of documents which proved that they had stolen what the French called the LAV, and they both went into a huddle, and they ended up agreeing to fund HIV research, and that's how it ended. But it didn't exactly pour glory over the NCI, and Robert Gallo and Anthony Fauci, who were involved with all that. And Anthony Fauci has also been apparently accused of funding HIV vaccine research, or in the China, and that's how apparently it got out of his laboratory, or his funded laboratory in Wuhan, and caused a world pandemic. So the NCI does have quite a few questions to answer, but they nevertheless give us the latest figures, and that's what I was trying to get hold of. And the US, let's see if I can give you these now. I also will put up tables so you can see them and read them better. But the NCI and have a program called SEER, and that program is what collects the data and distributes it. And if I can find that, yeah, here we are. The reports funds available between well, the funds available to them in 2018 were billion dollars, $7.1 billion, and that was up 5.7% on the previous year. They have some various programs, including Moonshot, started in December 2016, and that authorized $1.8 billion over 7 years to accelerate prevention and screening. And in 2023, that program funded $216 million. And as for funding of various types of cancer, the highest is $2.7 billion on breast cancer, which is 11% of their total, $2.3 billion on hemo funding, and $1.3 billion on brain cancer funding. So that you can see from that the US is spending a far greater amount on cancer research than the UK. Never mind, the UK is still funding quite a lot of stuff. But let's get a hold of the global figures, because that's where we're really interested, because that's where any breakthroughs might be found. Doesn't have to be in any particular one country. It'll soon get translated to everywhere else. So the amount of new cases in the world last year was 19.3, and the number of deaths in 2020 was 10 million. The number of deaths in the latest year was, I believe, 9.7 million, and that's the global picture. But what's happening is that the changes are occurring within age groups. For example, the 25 to 49 year age group is increasing all around the world, and whereas the 50 plus, the 50 to 74 age group is declining slightly, that's rather more due to prevention than any particular form of cancer treatment which has been discovered and transmitted by the research. So we've got a situation where enormous millions of pounds each year are going into cancer research. The next thing I want to look at really is what kind of research they're doing, because the statistics of mortality and prevalence and incidence are not going down, and that's the point. How can someone spend 400 million in 1 year to try and cure a disease and not have some kind of success? And furthermore, not spend any of that money, or much of it, on other forms of treatment than the three majors. And the three majors, of course, are surgical resection or incision, the chemotherapies, and the radiotherapies. There are some immunotherapies as well, but those aren't really being applied. Maybe they're doing the research, and I'll be showing you some studies which report that. But areas, whole areas like phytochemicals, the impact of phytochemicals on cancer, which has been shown in many studies to be useful, I don't see much research going into that. And other therapies which have got some kind of clinical evidence, if not a lot of clinical evidence, like the Koch remedies, the use of ivermectin, and the other things like IMM101, which is an immunotherapy, they're not being applied. So there's something really seriously wrong in the system, that so much money, I mean, I could almost re-quote Churchill. I mean, never in the history of science has so much money been applied by so many for so little result. I'm going to have to fight them on the beaches on that one.